Hey everyone, today's video I'm going to walk you through a case study of a real live patient from my office. This is a 5-year-old boy with autism, and just to quickly kind of give you his presenting symptoms, he has a speech delay, which is not unexpected. That's one of the criteria. Typically, you've got to have a verbal speech delay to get diagnosed with an autism spectrum disorder. He also has screaming and crying randomly. Sometimes he'll do that for a long time. It's very repetitive or perseverative. He also has repetitive hand movements, and I'll explain kind of what those mean and what clues those are giving us in just a minute. He has prolonged tantrums, meaning these tantrums can last for an hour or an hour and a half. That again is telling us something specifically about his brain function that we can use to help treat him. At school, he can only remain seated for about 5 minutes. He has kind of internal motor. He's also had some scratching in his rectal area. There's some kind of perhaps a critter that doesn't belong. So with that in mind, if you have a child with autism or you know someone with autism, I think you'll find this video very helpful because it's going to go through kind of my approach, the approach that I use, and kind of let you know what to look for in a provider if you've got a child with autism. All right, so the history. Now, the history is always really important because the history can give you different clues about the mechanisms behind what you're seeing in that child's behavior today. And with that in mind, let me just start and tell you that my approach to autism spectrum disorders and other neurodevelopmental disorders is kind of twofold. I call it a neurometabolic approach. And essentially what that means is metabolically or biochemically, we're looking for all the things that we know that can disturb brain function and brain development. And that is a super long list. I'm not even going to go into it, but some of the highlights include autoimmunity, inflammatory problems, gut dysbiosis. There's a lot more than that, but that's kind of the general idea. And the other thing that I look at are what I call circuit malfunction. Now, clearly in autistic children, there are things that aren't working the way that we would expect them to. The question is, why is it that way? And what are we going to do to help it? So circuit malfunction, what I mean by that is I'm saying it's parts of the brain that are either working too fast or too slow or not integrated or not coordinated, but it's not because of a inflammatory problem or a vitamin deficiency or a dysbiosis. All right. Now with that in mind, let's walk through this case. So first thing is it was significant for a C-section delivery, and it's known that kids that are delivered via C-section have a little more increased risk for autism. At 3 weeks old, he was in the hospital due to bronchiolitis. So 3 weeks old, he's suffering an inflammatory event in the lungs. That's making me think of lung barrier compromise. Barriers in the body are really, really important for establishing immune system tolerance. So right away, I'm seeing 3 weeks old, he was in the hospital due to inflammation of his bronchioles. That makes me wonder about asthma, perhaps development of autoimmunity. He had some skin irritation, another barrier. The following few years were full of infections and rounds of antibiotics. So again, antibiotics may be necessary to get rid of an infection. And antibiotics are interesting. They all have an anti-inflammatory profile. But as you probably also know, the way that they affect your microbiome in different places can really disrupt the barrier function and create a hyper leaky gut primarily, which can then on its own promote inflammation and all kinds of other things that are not that great. In July of 2019, he was noted to have good eye contact and was following instructions, but had delayed speech. Okay, so for this particular child's phenotype, he had pretty good eye contact, had some verbal understanding, and had some delayed verbal communication. A few months after that, he had a fever, which was due to a nasal infection, another infection. I'm really curious about this kid's immune system, very curious. In fact, I'll just tell you, most of the kids that make it to me that are on the autism spectrum have got something going on with their immune system that either A, hasn't been picked up, or B, hasn't been really managed or addressed correctly. So he had another antibiotic. All right, a few months after that, he had a significant upper respiratory restriction due to tonsil and adenoid hypertrophy. He had to have his adenoids taken out. And he really hasn't had any more infections. Okay, great. So his adenoids were probably acting as more as a reservoir for different bacterial infections. And it's a good thing he had them out, because if you have repeated infections and repeated infections and repeated infections, you're really at risk for cross-reaction. Now again, cross-reaction, if you haven't heard of that before, I have a lot of other videos where I talk about this. Cross-reaction is when the immune system makes antibodies, like a little post-it note, for one thing, but that antibody can stick onto other things because the other things look molecularly similar to the first thing. A great example is strep infections. Streptococcal infections are a very common cross-reactor. And what that means practically speaking, especially as it relates to autism, is when you make antibodies for the strep, The antibodies for the strep can attach to a part of your brain called the basal ganglia. They can attach to other tissues in the body and create immune system mediated dysfunction. And that's what could be happening with this kid already, but certainly could still be happening if he was still having infections 3 years later. In 2021, he had some ABA therapy, applied behavioral analysis. Big fan of that as long as the kid is able to participate and able to handle it, because it can be very fatiguing, and a lot of kids have what we call a low metabolic capacity, and so sometimes they're not even participating and getting out of ABA what they could get done. In fact, there's a ABA office 2 doors down from my current office. So he had a variety of testing done, saw a few different practitioners, none of which were really able to do any kind of real improvement. In 2021 of September, he had a little bit of bump up in his language, and he began saying phrases such as, I want. Now this is good, because saying I, right, first person, that is a good thing. Rather than saying like his name wants or me want, he's saying I want, so we like that. He was prescribed, and this is a problem here, a large amount of supplements by a person calling herself a toxicologist. Now, I don't want to throw this person under the bus too bad, but they were not trained. They certainly have no business treating kids with autism. 3 days after taking those, he had muscle weakness, drowsiness, vomiting. So fortunately, the parents said, well, that's obviously not normal. We're stopping that. Now, I'm not going to say that that person set him back, but they wasted a lot of time, and the parents really got jaded with that experience, because here's someone saying they'd have a, an alternative approach, but it was really just kind of like, bunk, for lack of a better term. He has been using camel's milk and has had no need for an asthma pump since taking that. Now, listen, I mentioned a few minutes ago he had the bronchiolitis, he had this other stuff. I was worried about asthma. Well, he developed asthma, and after taking camel's milk, well, I know it sounds weird, but camel's milk has some interesting immune modulating properties, and since doing that, he hasn't had to use asthma. He hasn't had to use his asthma medication, which is great. Now, you may wonder, camel's milk, where do you get that? Well, you can get it here in the U.S. This family actually is from Africa, so it was not a big deal for them to get it either. All right, so now he's coming into my office. He's currently taking some probiotics. He's using turmeric, folic acid, omegas, and a metagenics product called Ultra Clear Renew. I don't really have a problem with any of those. We don't really know what his immunophenotype is, meaning we don't know what his immune system really needs. Those are just kind of like little, kind of a shotgun approach, and there's nothing like, I'm concerned about there. Now, he does have a history of anemia, and he has been given iron in the past. Now, I assume he had a true iron deficiency anemia, because I don't know if you guys know this, but anemia has come in a lot of different forms. Anemia just means you don't have enough red blood cells or hemoglobin or hematocrit. But saying anemia doesn't tell you what kind of anemia is it. Is it a B12 anemia, a blood loss anemia, a folic acid anemia, anemia of chronic inflammation? There's a bunch of different kinds. So I assume that whoever discovered the anemia was able to categorize it correctly. There was some genetic SNP testing, which is single nucleotide polymorphism, that showed some deletions in GSTM1. Now that's going to affect glutathione. I don't want to go deep into that too much, but it is going to affect his ability to use his natural substance that we make called glutathione. Glutathione is important because glutathione's it's an immune system regulator. It's also a huge part of our liver's biotransformation detoxification system. So having some problems with that, it could immediately impact his immune system. All right, now, when he comes into the office and I'm looking at him, he has what I would call akathisia. Now, akathisia is a technical term for meaning he's kind of constantly in motion. It's like a wind-up toy, and he's just moving all the time. And that is not uncommon with autistic kids. And I would not call that hyperactivity per se. I would call it akathisia, because where that's coming from in this kid, I think it's coming from a part of the brain called the basal ganglia. Now, I didn't want to get too deep into that, but I have to talk about it a little bit because that's what this kid has. Basal ganglia is a structure deep in the brain, and it's basically a filter or a gate. Anything that this kid wants to do has got to go through the gate, got to go through the filter. Whether it's moving or thinking or emotions, it's got to go through the gate. Now, when the gate is leaky, it lets things through that shouldn't go through. And sometimes when there's a problem with the gate and the filter, you can get repetitive movements. Remember, that's what this kid has, right? You can get behaviors that once they start won't stop, like a tantrum. So I think this kid has got basal ganglia dysfunction. And I'll just let you know, the vast majority of kids that I see that do any type of repetitive behavior, they have a basal ganglia dysfunction. Now, saying that doesn't really tell you anything about why it's there, and it can be more complicated than that. We don't know if it's a primary basal ganglia problem or a problem with the areas that feed into the basal ganglia, but we know that there's a problem. So is this sporadic repetitive jumping? Okay, this is probably basal ganglionic because the basal ganglia works with the frontal lobes to make you not impulsive, not compulsive, be able to pay attention. So he's got a problem in that circuit. Can shake his hands. Sometimes these are what we call stereotypies is what we call that, which means they're purposeless movements kind of occurring in the midline, but they're telling you that he has a basal ganglia problem. His mouth is open almost all the time, and I'm a little concerned about that because in adults, if your mouth is open all the time, right, that's usually not a good sign about your frontal lobe function. In fact, in Parkinson's patients, when we work those people up, that's called hypomimia, meaning you have decreased tone in your face. And mouth open most of the time is the worst. That's like a grade 4 on the UPDRS scale. So a little concerned about him. Maybe he just has trouble breathing. Now he does have functional language. This is good. He said toilet, so he could go to the bathroom. I saw him do that. And he is toilet trained, which is great. Now, upon leaving the office on his initial exam, he was able to say goodbye and thank you. Now, he had to be prompted to do that. He had to echo that, but he was able to do it. So we know that he can talk, he can make the sounds, and he has a motor control to do that. But he does not respond very quickly to his name when being called. Now, that's not specific. That's not necessarily a hearing problem. It's not necessarily a verbal comprehension problem. A lot of kids that are on the autism spectrum, because they have that kind of wind-up toy thing, they're very self-directed. They're very just doing what their internal motor is driving them to do. They're not that interested all the time in what other people want them to do. All right, with that in mind, here's the thing. He's got basal ganglia dysfunction, and we know that from the stereotypies with the repetitive behavior. And why is it there, though? Well, there's metabolic things that can definitely do this, and all the infections he had, I'm really worried about him having an autoimmune basal ganglia problem. So we're going to try to test for that, and I'll explain that in a second. Like I said, that's metabolic biochemical problems. He could have problems with mitochondria, but my main thing I'm concerned about is an immune system, just based on his history. Now, there can be circuit malfunction. We know the basal ganglia is the problem, but lots of things feed into the basal ganglia, the cerebellum, the frontal lobes, the parietal lobes, the midbrain. So it could be just a circuit problem where we need to take those basal ganglia circuits to the gym, right, and work them out. Or it could be that there's metabolic reasons messing with it, or it could be both. No rule, it just has to be one or the other, right? All right, so we did some labs, and you know, his CBC, which is red blood cells, white blood cells, the comp metabolic, methylonic acid, all this stuff was normal. All the stuff I'm showing you, all this stuff was normal. So I'm already going, well, that's pushing some things off the table, right? Everything's on the radar until we start finding things that don't need to be on the radar, and these things are normal, so I don't need to worry about them. The thyroid panel with antibodies, that was normal. Lipid panel was normal. Even by my kind of like, you know, quote unquote functional standards, these things were all normal. So what do we do next? Well, we did a multiple tissue autoimmune test. Now, I did want to do a lymphocyte immunophenotyping test, but because of some logistics and his age, they couldn't get the sample done in time, and they had to go back to Africa. But here's what we found, right? So if you guys have never seen this before, this is a kind of head-to-toe survey of tissue antibodies. Let's see if my cursor works. Yeah. And so over here on the left, these are all different tissues in the body that the immune system could attack. Now remember, antibodies, we all have these. These are not a big deal as long as you don't have a lot of them for a tissue. For example, he has elevated fibulin antibodies, right? And these aren't pediatric ranges, these are adult ranges. So he has a lot of fibulin antibodies. Well, what is that? Well, fibulin is something you find in some connective tissue. You also find it in very immune-mediated atherosclerotic lesions. So he doesn't really have any, you know, arthritis at this age, but we know that his immune system is targeting it big time, is definitely targeting. The other thing he has, and this is where I went, this is what I was concerned about. See this stuff here, alpha tubulin and beta tubulin? He's definitely out of range on that. So what is that? Well, alpha tubulin and beta tubulin antibodies, when those show up, those are associated, if you read the literature, with basal ganglia autoimmune things. They also show up in Hashimoto's and toxin exposure, but this is almost certainly telling us he's got a basal ganglia autoimmune problem. And so we got to figure out what we're going to do about that. Now again, I wanted to do the immunophenotyping. We weren't able to do it. We just had to go with what we had. Now there are a few little auxiliary tests I wanted to do with him. And we did a urinary organic acids test because you can, depending on what lab you use, and the lab that I use, it reflects this stuff. It lets you look at fatty acid metabolism and carbohydrate metabolism, and is the kid making energy, and what's the mitochondria doing, in general. And this substance right here, when it's elevated, like it is with him, xanthorenate, that means he needs vitamin B6. It's a clear indication of a need for vitamin B6, right? So we're probably gonna have to give him that. Kynurenate is another substance that when it's high means you need vitamin B6. So I got 2 markers saying this kid needs B6. And if you've been in the autism community at all, B6 problems are very, very well known. The issue with B6 and autism is there's 2 forms of B6 essentially. There's pyridoxine and then there's pyridoxal 5-phosphate. And converting pyridoxine, which is sort of inactive, to pyridoxal 5-phosphate, the active form, requires glutathione. Remember that? Remember he has some deletions in that little system? So we're probably going to have to give this kid B6, and we're probably going to have to give him glutathione. Now, I'm going to warn you now, I'm not going to lay out specifically everything I did for him because I don't want you trying to treat your kids on your own, because it's more complicated than that. And I know a lot of people over the years have tried, and I'll tell you, half the parents I get have said, well, we don't know what to do. Like, we can't make sense of all this. We can't treat them ourselves. We need somebody that knows what they're doing, right? So, just warning you. Now, we also did a stool test, and the thing I want to show you here is, see that right there? It says the actinobacteria phylum was about 50% less than a healthy cohort. Well, we're going to want to do something about that. Now, the thing is, bifidobacterium, that makes up part of this phylum. You've probably heard of that, right? There's bifidobacterium, which are a probiotic species, which do good things for us. And I'm just showing you this because this is part of the stool test we did. And it was pretty obvious he was way off on that one. So we're going to have to deal with that. And then looking at the other things from that stool test, he has 2 very elevated intestinal inflammation markers. He's got calprotectin, which is very elevated, and fecal secretory IgA, which is very elevated. Now, if this was an adult, I'd be concerned maybe that they might have some sort of colon cancer, but he doesn't have that. He just has GI inflammation. We're going to have to deal with that. So what do we do? Well, we gave him a specific probiotic formula to address the stuff that I saw. I kind of changed him, switched him from the one he was using. I'm not going to tell you what it was. We used an anti-inflammatory support and immune regulation protocol. Again, I'm not going to go through the specifics of that because what your kid needs or what some other kid needs may not be what he needs. So just this is what we did. I also gave him B6. Now again, I gave him pyridoxal 5-phosphate, and I gave him a certain amount that was specific to him. And I would never give an autistic child non-pyridoxal 5-phosphate B6. I also put him on a 100% gluten-free diet. Forget that headline, it says 60 days. I borrowed that from another slide. So we did 4 days of in-office brain-based rehab because they were here from Africa. He clearly has a basal ganglia problem. I might as well go ahead and try to treat what we see. So we started using rhythmic timing with audio-visual feedback to the millisecond. Now, you may recognize that and go, wait a minute, is that the interactive metronome? And it is. I use a very specific, I want to say modified, customized version of interactive metronome for these kids. And I just don't do like the standard sort of protocols that the company teaches you. Not that they're bad, but I've been using interactive metronome for a very, very long time. And for me, it is the best way to get into these basal ganglia frontal lobe circuits and start to exercise them and start to try to make them perform correctly. Now, the 4th day, while doing it by himself, he's 5, he's doing it by himself, he had what we know is 3 bursts, and that's with a burst threshold, a super ride-on threshold of 35 milliseconds. Let me just tell you, that's very impressive. He's 5 years old, he's doing it on his own. I don't have to do it hand over hand anymore. He did 3 bursts, which is 4 hits in a row within 35 milliseconds of the reference tone, the cowbell. It's fantastic, and I thought to myself, this is going to work really well for him. So let's see how it did. So, after 4 days of the brain-based rehab, he's using language to say toilet, which he's done every session, and he did actually have to go to the bathroom when he said that, so that's good. He's getting cues, he's verbally communicating them. And his dad reported that while they were in the restroom, he asked Terry, this is not the kid's real name, he asked Terry what he wanted, and Terry said, "I want to switch on the light." That is a full, complete sentence. He had not done that before. Dad noted that he had also taught Terry before today to say, "I love you too, Daddy," And today Terry said, "I love you too, Mommy," without prompting, without echoing. His mom said, "I love you, Terry." And Terry said back, "I love you too, Mommy." I mean, we all had a little cry because it was, I'm going to do it right now because it was so cool. So during the session after this last interactive metronome exercise, I was rolling him in the chair, just kind of like a little fun thing to do as a bit of an interlude. And instead of me, modeling and trying to get him to say, "Can you say I want to?" I said, "Tell me what you want." And Terry said, "I want to go 1, 2, 3. That's what we'd say. We'd say 1, 2, 3. This is really good. So in 4 days, doing the right type of brain-based rehab for him, his circuit malfunction, we're getting really good verbal changes. Now, what happens over time, right? What happens over time? Because that's really what's important. Not what happens over 4 or 5 days. What happens over time? Okay, so they returned to Africa with a home interactive metronome unit. And again, I'm not telling you to go buy one. I don't have any financial interest in that. It may not be appropriate for your child or another child that you know. But I gave him a very customized treatment plan that we alter as time goes by. He's taking the supplement protocol that I mentioned. And how did he do? All right, so 6 months later, this is what his parents tell me. They send me an email. They say, "Hey, we hope all is well with you. You requested an update. He is now speaking in mostly full sentences. His speech is not yet conversational, but he's able to tell us what he needs and often comments on the environment. This past weekend, I asked him to put on his underwear, and he said to me, 'It's wet.' It was slightly wet from washing. Then I asked him to wear his pants without the underwear, and he said, 'I want to put on underwear.'" I mean, this is great, right? This is good stuff. This is a kid with a real verbal speech delay who's now doing this. Then he went to his room and got his underwear and put it on. He negotiates a lot. As an example, him asking for an apple, then I say to him that he must drink water, and then he responds and says, "First water, then apple." He's completely potty trained, even at night, big win for them. And that is really kind of a red letter day. Some kids with autism, when they're not potty trained or toilet trained, it's telling you there's a delay in how their frontal lobe is working. And so when they become toilet trained, that's kind of a red letter day. They say he's attending remedial school where they're continually impressed with his progress. They have an ABA program where they're at, adding new targets for him almost weekly because he's grasping concepts a lot quicker. The echolalia that he had is almost non-existent. He still has some repetitive behaviors and a little bit of what they call OCD, but a lot milder. They completed what's called an autism treatment evaluation checklist in 2021, and his score was a 51, and now they repeated another one, and it's a 27, which is a big drop. Big drop. Lower is better. And they're seeing progress. So why am I showing you this case, right? So I went through 15, 20 minutes of this case. It's because I believe that every child has an unlimited potential to get better. And so you got to make sure you're working with someone who's not going to put a ceiling on your kid, right? Because autism spectrum disorder, that kind of describes what's happening. It does not tell you what to do, okay? It does not tell you what is this kid's autism, right? It does not tell you that they need XYZ therapy. They may benefit from it, but I encourage everyone to work with someone who's taking every kid on their own terms, right? And digging in and finding out, hey, what's working? What's not working? What are the metabolic factors? Is it an immune system problem? Is it a mitochondrial problem? Is it something else? You got to really step back and take a big picture. And then you've also got to make sure for maximum benefit or maximum results, hopefully you're working with someone that can do both, right? Look at the neurologic factors, know how to rehab those, know what tests to order, how to interpret them, what to do about it. So what I want you to realize, and I hope you get that from watching this, is that there's a lot that can be done for a child that's on the autism spectrum. Don't give up. There's a lot that can be done. For me, I look at all these kids as very, very long-term relationships because there's a lot that can happen as they're growing and getting older. And I've been doing this for 20 years, and I have a lot of these cases I could share with you. So don't give up hope, right? Make sure you find someone that has the right attitude walking in about your kid's potential and what can happen, and then knows what to test and what to evaluate, and then how to fix it, all right? All right, I'll see you next time.